Alright, so my name is Jenna Kryling. It is August 6th, 2020. On the flip side here, I just have my names of structures and my talking points. Alright, so looking at the surface anatomy structures, I have them marked in red just to make it a little bit more clear on camera. So starting up here, my first structure is going to be the body of the sternum. So that's right here right on the nipple line. And then looking at the inferior portion of the sternum, we have the xiphoid process. So you can see that's kind of where the ribs come up to a V point. And then this little dotted line going down the abdominal region is the linea alba. So that's the kind of connective tissue-like structure that separates the rectus abdominis. So the linea alba is a part of the muscular system, and then the sternum and the xiphoid process are both a part of the skeletal system. So moving right on down this way, we have a couple more structures. So you can see the calcaneal tendon right here on the posterior side of the leg, also commonly called the Achilles tendon. And then looking right here, this dot is the medial malleolus of the tibia. And that's kind of the protruding ankle bone that you can see on the side of your ankle. This is, again, a bone, so part of the skeletal system. And the calcaneal tendon is part of the musculoskeletal system, because it obviously connects bone to muscle. So surface anatomy is really important for a few different reasons. It can be really useful as far as diagnosing and treating different medical conditions, like in the clinical quiz we took where someone needed to have an incision made on their neck because of a choking incident. They were able to do that because they knew the surface anatomy of the neck. As far as these structures go, the medial malleolus can be really useful just for finding the palpation point for the tibial artery, which is another surface anatomy structure. And knowing where the tibial artery palpation point is can be really useful as far as just finding a pulse if maybe the arm or neck isn't available. The tibial artery is also a really common site for stent insertion, so if someone's having a heart operation, they can use this artery and make it a much less invasive procedure. Looking at our structures up top, another clinical application. So the sternum and the xiphoid process kind of go together, and they're really important as far as like CPR chest compressions, and they're talked about a lot in these classes. So it is really important to do chest compressions on the sternal body. If someone's not aware of the surface anatomy and where these structures are, they could go down to where the xiphoid process is, which can be really dangerous with chest compressions because this little fragment of bone can chip off and become lodged with the internal organs. And so those are just a couple examples as to how knowing surface anatomy can be really, really important as far as medical care goes. And I think that should be it as far as structures, their function, their system, and a little overview of the importance of surface anatomy.